We're going to see the invasive imaging testing for the lung. Usually we have the chest X-ray, the PET scan, and the CT scan or computed tomography chest scan. The chest X-ray is the most common and usually is the first test that we do for every lung complaint or thing that we want to see, like some screening. For example, for lung cancer, sometimes we see signs of a disease before the symptoms arrive, and sometimes we can see things in the chest X-ray that would lead us to do another testing. For example, if we see a solitary nodule or things like that, it depends. The chest X-ray is not used for confirmatory diagnosis, for example, of cancer or nodules, etc. The CT scan has more sensitivity than the chest X-ray sometimes, and is less flexible to mobilization of the patient. So in this, the chest X-ray can be visualized a little more moved than this, so we would be ever testing. The CT scan could be with high dose contrast, low dose, or no contrast. The no contrast is, for example, a high resolution CT scan do not have contrast, and a high resolution CT scan is high resolution because the slices of the imaging are smaller, so has more slices, and we have more affinity of the lesions that we can see. The low dose is usually used for other diseases like some screening or for visualizing honeycomb lesions for interstitial lung disease. The CT scan assesses the mediastinum, pleura, and interstitium of the lung. Sometimes we can also use the CT angiography, in which we put a bolus of contrast and we do the CT scan, while the intravenous contrast makes it more visible the pulmonary artery tree. And this will be diagnosis for a pulmonary thromboembolism. And the PET scan, this is used for actively metabolically active tissue in which there is increased, for example, glucose uptake. For example, in a lung cancer, there is increased glucose uptake, and so it is metabolically active, and that will be catch in the PET scan. Usually is also performed with a CT in order to localize anatomically the metabolically active lesion that we are seeing in the PET scan. And this is an excellent test to see early stage of diseases, and these sometimes will be needed for lung cancer. We will see this in the solitary nodule video. And the PET scan differentiates between benign lesions and malignant, infectious, and inflammatory lesions. A benign lesion could be, for example, scarring tissue. Both cannot differentiate between malignant, inflammatory, or infectious lesions. In the next video, we're going to talk about the invasive testing for lung diseases.